Today, on International Women's Day, we wanted to highlight some of the top medical concerns of modern women in our weekly medical segment. According to a recent report by the Alberta Women's Health Foundation, it finds that taboos and stigmas surrounding women's health issues, such as menopause, periods, and endometriosis, can have an impact on proper knowledge and treatment. And taboos aren't the only issue impacting proper health care for women. According to a report from the Heart and Stroke Foundation, symptoms of a heart attack are not recognized in 50% of women. The report also highlights the inequities that women face when it comes to heart and brain health care. Well, joining us now to give us more insight into this issue and his advice in terms of women's health is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Good evening and happy Women's Day.
Happy Women's Day. Now, looking at these numbers, Dr. Raut, they can be surprising. So, why is there such a discrepancy when it comes to the treatment for heart and brain problems in women?
Right. So very, very surprising here. What we're seeing is women who experience a heart attack are less likely to receive the treatments that men do and get them in a timely fashion. 50% of women will have their symptoms go unrecognized for heart attacks. And the question is why? What we have to realize is women's bodies are not the same as men's, and neither are their lives. We're seeing biological differences that women face, unique risk factors, and at different points in their lives as well, which makes these experiences far more different. There's also social differences in terms of women's health. The average woman earning more than a man, and women taking on the majority of unpaid caregiving responsibilities. All of these do affect and put a lot of negative health consequences as a result. And we're starting to see that in the research coming up now.
Good thing that there is research looking into this. We definitely need more clarity into women's health. Now, are there any other health issues that may not be properly recognized or identified in women right now?
Right. So I think we're just seeing the beginning. The traditional risk factors we would have, even for things like smoking, high blood pressure, diabetes, all increase the odds of heart disease and stroke for men and women. But women also face very unique risk factors, hormonal challenges during their life courses, complications during pregnancy, as well as use of oral contraceptives, hormone replacement therapy, and as you mentioned as well, endometriosis and menopause, all playing roles here for a vast majority of conditions.
So, how can women get the proper diagnosis or treatment they need amid these obstacles, Dr. Raut?
Right. And of course, the obstacles are many. I think the importance here is focusing very much on awareness. Women really can't relieve or receive a timely diagnosis and care if the people around them, including family members and healthcare providers, don't recognize that they need help. That's why it's important to have these public awareness to discuss things like heart disease and stroke in women, and specifically educate women, their partners, as well as healthcare providers on these risk factors.
And on that note, I'd love to jump to the issue of health taboos and stigmas. So, how do they play a role in preventing women the proper treatment they need, especially for conditions related to the reproductive system?
Right. So as Charlene Rutherford did say, taboos are these social customs that are restricting discussion on specific topics. What they do is they really create a culture of silence. It limits access to knowledge and care, and people don't want to seek that knowledge and care either. And taboos then therefore can harm an individual's health, an individual's mental health, and their well-being as well. A lot of research being done on this now, respondents showing that taboo subjects like painful periods, pelvic floor dysfunction, yeast infections, all of these they find very difficult to talk to their primary healthcare provider about these concerns. And they also identified that they're not very knowledgeable about these. So the importance here is, again, education and making sure we can break these taboos.
Definitely, Doctor. Just about a minute left here, but we often hear that it's normal to experience certain pains in our body as women, and maybe we require just some painkillers. But how can a woman effectively determine when it's time to go to a doctor?
All right. So the best advice I can give here is, it's 2023 and you should not be living in pain. If you're in pain and if you think it's normal, even if you do, see your doctor. And if your doctor isn't giving you a satisfactory answer or treatment, politely ask for a referral. Women's pain can affect treatment in a variety of areas: heart problems, stroke, reproductive health, chronic illnesses, adolescent pain, and physical pain. So we definitely need to be taking pain very seriously. So please don't delay. Even if you think it's normal, go see your doctor.
Take your pain seriously. All right, Dr. Rout, again, thank you so much for your time today.
Thanks so much for having me.